Hi, this is Tim Van Biesen joining you from Westchester County, New York. I wanted to take some time today to share with you some emerging perspectives from Bain and Company on the COVID-19 crisis and how it is impacting the healthcare sector. This is an exceptionally challenging time for the global economy, and everyone is impacted by the current crisis, and particularly our disadvantaged and underserved populations are bearing the brunt of the effect. Not a single company in healthcare is unaffected by this dynamic either, and the bulk of the burden is being carried by the providers of clinical care, physicians, nurses, and other care providers. Healthcare is increasingly being re-recognized as a core part of our economic infrastructure. In some ways, it's the new form of national defense, and that's likely to have a number of follow-on implications. Increased federal or government entity funding for some selected therapeutic areas or disease areas, possible reimbursement reform to eliminate the financial penalty associated with the mix shift of procedures away from elective or deferrable surgeries to those that require urgent care, and possibly even an increased tolerance for pricing that clearly allows reinvestment in next generation research and development. The way manufacturers today access clinical care providers through direct interaction with physicians in their offices and inside operating rooms is likely to change. And this will have direct impacts for pharmaceutical and medical products and medical devices manufacturers. First, they'll have to support the shift to alternate sites of care, which will require a broader network of coverage for their sales organizations. They may have to navigate increasing restrictions to physician and operating rooms, given the need to drive increased infection prevention protocols. And they'll have to focus on integrating their products into standardized care management and clinical care protocols to ensure product pull-through. Manufacturers are also focused on building resiliency and insurance into their supply chains. As the crisis highlights, supply chain integrity is always more important than managing costs. No one can afford to trade off product availability or quality in return for lower product costs. This means manufacturers are going to need to add several dimensions to their supply chains. They're going to need to multi-source from two or more vendors. They'll need to multi-source from two or more geographies and consider using third parties like contract manufacturers to back up captive production capacity. If there's a silver lining in this at all for the healthcare industry, it's that it will be the driver of the solution. It'll develop the products, the vaccines, the treatments, the diagnostics that'll get us through this crisis. Thank you for your time and wishing you safety and good health.